You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures, that nobody should be wearing a loose-fitting denture. He's an expert on the topic, Dr. Joe Griffin. Dr. Griffin, welcome to the program.
Good morning, Randy. How are you?
Good. Now, for people that don't know your practice, I guess you have a large practice. Very busy.
We do.
Who's the typical patient?
Randy, we have over 8,000 dental patients in our practice. We have 5 wonderful doctors to service their needs. We do everything from whitening, we do metal-free fillings, we do mini implants, traditional implants, do full mouth reconstruction, veneers, dentures, partials, whatever they need. And we have a very active hygiene program with 5 fabulous hygienists.
So you have this concept, kind of this new thing in dentistry where you do everything right there.
Absolutely. We have
So like root canals?
Yeah, we have a specialist that teaches at the medical university, but he also comes to my practice twice a week, Wednesdays and Fridays. He's a big asset.
Okay, good.
Yeah.
Now you say no more dentures. You believe that?
Randy, that's where it's going. That's just the situation that, technology is catching up with every facet of our lives. And dentistry is no different. People used to have these, for years and years and years, people had to wear plastic denture. It covered the roof of their mouth. It affected their taste. It just affected their the way they feel about themselves. But now we have snap-in dentures with these MiniDental implants, and they're very effective. And patients are loving it. The doctors are loving it. The doctors are talking about, don't even want to think about retiring anymore because dentistry is fun
Is
again.
that right?
Yeah, it's fun again. It's not. Dentistry is exciting again because of what we're bringing to people's lives.
You say you're changing lives. You believe that?
I absolutely believe that. I believe it because of what I see and what I hear from my patients. You go from having a denture that covers the roof of your mouth, and you have to put powder or paste in it. You have to taste that all day long. You have to clean it. Do you go in the bathroom? You don't want your husband or your wife to see you without your teeth. You go from teaching in history class and your dentures are falling out to not worrying about it, to be able to chew what you want to chew. When you go into an implant-supported denture, a mini implant denture that snaps in, you go into a restaurant and you have a menu. So what do I order? What do I get to order today? Is it going to be mashed potatoes, soft butter beans, soft bread? It can't be toast. It can't be a nut. It can't be a steak. It has to be, you have to choose, but not anymore. So you're back to the way you were. So you might have thought that was a hopeless situation, but it's not hopeless because of the technology of MiniDental implants. And patients are loving it.
Is that right?
Yeah.
So now you do everything there. I guess the way it's normally done is you go to one place that does the surgery, right? You go to another dentist that puts the tooth on top, right?
No.
Now you do both parts?
Oh, absolutely.
At your place.
Yeah, and that is the real beauty, the synergy of having 5 qualified doctors. We have over 150 years of clinical experience. So when you come to my practice, our team practice, you get the implant, the surgery. If your teeth needs endodontic treatment, periodontal treatment, we can generally have
In the same day?
Many times the same day.
Now you say, okay, let's say if everything works out right, that
All right,
people can walk in without teeth and walk out with teeth. Is that true?
Yeah. Well, earlier this week was a very emotional time. A man walks in, very proud of his smile, very successful man. He traveled some 7 hours. I was, really humbled that he would travel so far. So he comes in, he's missing a tooth. And he has to have the tooth removed. We take the tooth out the same day, put the implant in, put the temporary crown on so he looks just as good, if not better, when he walked in. And he walks out. I call him that night, and I kid you not. I said, well, hey, bud, how's it going? You doing okay? Doc, I can't tell you did anything. I said, you got to be kidding. Really? That's great. So those are the reports we get. But we did some advanced treatment with this gentleman. We don't just remove people's teeth. We be able to put in there a bone graft material that we use your own blood, we do. And you put it in there. It helps it heal much quicker, much faster. And we use your body's own mesenchymal growth factor cells to help grow the bone right around the implant the same day.
So less downtime, things like that?
Gosh, there's no downtime for him. He walked out with a tooth.
How soon could they eat?
Randy, I would answer that question with a question. How long does it take you, if you had a snap-in denture, to get to your favorite restaurant? That's how long it takes. So go get in the car, drive to whatever restaurant that you want to go to.
So they can eat the same day?
No, they're not going to just eat the same day. They're going to eat what they want to the same day. It's going to be the best day of the rest of their life. I'm not kidding. And they call back and say, wow. I said, yeah, I know. That's just technology.
Are they even skeptical that they could eat so soon?
Well, I was,
Seems like it would be excruciating pain.
No.
You just had the implants in.
Well, see, that's the thing about these implants.
Because these are mini implants, not to be confused with traditional.
No, absolutely. These are not the traditional root form implants where you have to remove a fair amount of bone. These implants, we like to say 5 times less. They're 5 times less surgery. They're 5 times less invasive. 5 times there's less time, less trips to the dentist, and many times almost half the cost. So yeah,
and they work.
Of course they work.
Okay.
The implants are coated with a special coating. Well, I don't want to get into too many details, but calcium phosphate, and it stimulates that bone to grow rapidly.
So the bone just grabs onto it?
Not only grabs onto it, but grabs onto the implant and grows up the implant. So it's real exciting.
We're going to take a quick break. We come back, a little bit more about the process when somebody goes in there, and especially if they're wearing dentures.
Yes.
You're watching the Wellness Hour. I'm Randy Alvarez. We'll be right back.
Before, when I would be speaking to my students, my teeth would move. Not anymore. They are just as solid as my natural teeth were.
Come see us at Advanced Dental Center. Call now at 843-629-8000.
You're watching the Wellness Hour. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have Dr. Joe Griffin. So Dr. Griffin, if in your area, South Carolina, are there a lot of people wearing dentures, like an upper lower denture or headed to dentures?
Randy, unfortunately, there is a huge problem. If you went to the Florence Civic Center, you could probably fill that up 7 times or more, conservatively. I mean, just full of people that have dentures, missing 1 or 2 teeth, or wearing partials. Randy, you would not believe it, but actually Florence, South Carolina is probably considered one of the denture capitals of the world. We were the first place you could go in and get out your teeth in the same day. So there's just tons of people, not only in my area, but that come from far and wide to our area.
So your problem with dentures is they're just not attached to anything. Is that right?
That's right. The problem with dentures, it's unfortunate that they only, a good set of dentures, you get 10 to 15% of the chewing efficiency of your natural teeth. Well, unfortunately with dentures, they don't really replace your natural teeth. It's a Band-Aid. It's something that works a lot better than nothing, but sometimes you feel like it's not better than nothing. And that's what MiniDental Implants, they give you that confidence back, a secure set of teeth that snap in. It's unbelievable. Well, listen, this is a model right here.
Okay.
You take this, listen to this. That's what I'm talking about. It's secure.
So this is with mini implants.
Yeah, it's secure.
And you just...
It's hard to get off.
I'm not exaggerating. Okay, so we have 4 implants here.
Yes.
Snap it. Do they look real?
Absolutely. Yes.
So this is...
Yeah.
So they could eat what with that? Could they eat salads or whatever?
They could eat salads with cucumbers, nuts. They can eat bacon, steak, apples. That's the true test. When you can take a set of dentures and bite an apple, you've got a good set of teeth.
So you said you could fill the Civic Center with all these people that are missing either an upper denture, lower denture.
Yeah, it's unfortunate.
Why aren't they all doing it? What's your take on that? If mini implants are so good, what's your take?
They're wearing dentures. People that wear dentures don't go to the dentist. They don't really know what's happening out there. They don't know that they can go back to what they had. So they're not aware. They had a long period of time in their life that, they struggled with their teeth, and, they had a cavity, they had, root canals, and maybe the crown didn't work, it got decay up on this filling. The cost was just become more and more and more, and they basically just had to give up. And they ended up in a desperate situation. And they ended up with dentures that don't snap in.
So they don't want to go to the dentist. They don't want to go back.
They didn't like going the first time, and they don't want to go back.
Do you hear that even today? They say, hey, no offense, doctor, but I don't like going to the dentist. Do you hear that?
I get some, not as much, because our practice has become more spa-like. We do a lot of nice things. We sedation, we give, back massages, whatever it takes, earphones.
So they like going to your office. They like going to the dentist.
It's a lot better than it used to be. Even smells good, because the massage lady, she has all these oils, and she's so sweet. I mean, she gives me one once in a while, and it's nice. It makes the day go better, break up the day. Yeah, makes a difference. Another reason people don't come in is they think they're too old. They think, this isn't for them. That life's kind of over, but it's not.
How old can you be to get this done?
Well, like I said, early this week, I had an 80-year-old. We're going to restore his mouth. He's going to have a beautiful smile. He's going to be able to chew what he wants. He can have that confidence back again and enjoy life. There's a lot of things maybe things change. You get a little age on you. Maybe can't play basketball. You can't play football. You can't do this and that. You can still look good, though. You can still chew. You can still go out to eat a nice meal with a friend or a lady friend.
So this 80-year-old, he was wearing like a denture?
Yeah,
before he met you?
Well, worse than that, he had a bunch of failing teeth that he just couldn't chew at all. None of them came together. He lost too many. So we had to, take his teeth out and start over.
So that guy, that 80-year-old, was he wearing a lower denture?
We just gave him a fixed bridge of teeth that don't come out so he could chew again.
So 80-year-old, why would he want to do this at that age?
Randy, guess what? People 80 years old, they still want to date. They want to take their lady friend out for a nice dinner, and they want to be confident about it. They don't want to go out with missing teeth and, a smile that's incomplete. They want to go and sit down and try to impress their friends, have a nice dinner, and, talk about life, and have that confidence again. They want to look as young as possible. They don't want to think they're 80 years old. 80 is young anymore.
Yeah.
So they're still kicking.
So, but at that age, are the implants more likely to fall out?
Absolutely not.
At that age?
Oh, no, absolutely not. It all depends on the quality of the bone and do they have any compromising situations. But in general, no, we do more on older people than we do on anyone. So the age is not an issue. Well, another reason they don't come in is they're scared that it's going to be uncomfortable. Maybe it'd be even painful. But with MiniDental implants, see, that's one of the big advantages.
It does seem painful, by the way.
No, it's much less invasive. These mini implants, it's a smaller implant.
I think you told me it's like you pop them through the gums almost.
Exactly. You
Is that right?
You don't have to open up. No, you don't do the surgery and flap the gums back. You go directly through the gums. It's like I said, it's like a wood screw, and it just gently goes into the bone. We slowly put it in. It gently finds its place, and it's very comfortable.
So during the procedure, I guess it doesn't hurt at all.
Randy,
but what about afterwards? What's that like? What do they say? If everything goes right.
I know it's hard to believe. You would think, oh, implants, but these are MiniDental implants. They're much less invasive than the older traditional implants, the root form. If people are going and maybe a couple of Tylenol or a little bit of pain medication over the counter, but it's not, there's not like narcotics, the need for narcotics. Many people, they leave, they go have a nice dinner, and they eat what they want to eat.
So that night?
Yes, that night, that day.
I mean, do you tell them take it easy though, no hard foods?
Well, we don't, challenge them to go eat the roughest, toughest steak in America.
Okay.
But we say, go ahead, enjoy a meal. Take a bite out of that apple. Feel what it's like. Feel that confidence. Enjoy your investment. Here's another really nice advantage. Traditional implants, sometimes you can be 6 months, a year, getting it all together because you've got to let that implant osseointegrate with the bone or fuse to the bone. With MiniDental implants, there's less time. Like we said, many times you're going to leave that day. A 2-hour procedure. If you already have your dentures, many times we'll secure that denture and you're out and you're done. So much less time, much more convenient.
Yeah, but are they as effective as far as the mini implants versus the traditional implants?
Well, Randy, that's one of the biggest advantages we have is that the research is overwhelmingly positive for MiniDental implants, especially the new MiniDental implants with the fantastic coating. We have 10-year studies now. We have, and also leaders in our profession are advocating the use of MiniDental implants.
But these 10-year studies, how do they stack up against traditional implants?
They're neck and neck, right there with them. So that's a big deal. You don't want to just be fast and inexpensive. You want to be as good or better.
So these are less expensive.
Yes, they are less expensive, almost half as expensive as traditional, and much less time, much less discomfort. It's just good technology.
So no more traditional dentures.
No.
So you don't like dentures anymore?
No. I've never been a fan. I like fixed work. I like stuff that goes in your mouth and stays in your mouth. I don't like coming in and out.
I know a couple denture wearers, right?
Yeah.
They never complain about anything. Are you saying that there's no such thing as a happy denture wearer?
Well, Randy, they're not going to tell you they've got dentures. Do you think if you, a young man or a man goes out on a date and the woman has partials or dentures, that's the last thing she's going to talk about. I mean, she's going to have to go in the bathroom to, after she eats and maybe, brush her teeth or, whatever. But many wives or husbands, they never let their spouse, they don't want that. That just doesn't come up. That's worse than being undressed.
Now I know you're a big cosmetic dentistry guy, and we're going to have you back and interview you about smile makeovers.
Yeah.
Can they look real? Can they look like real teeth?
Oh, absolutely. Oh, they're beautiful zirconium teeth. They look like veneers or smile makeover, and they stay in. That's what I like. That's what I'm excited about. You cover the roof of your mouth, you can't taste and eat, you don't feel romantic with dentures. There's nothing romantic about a denture, but beautiful veneer, smile, makeover teeth, nice teeth like you have. People are happy about that. Yeah, you look great, and that's what people want. They want to look like you.
Well, that's nice. Okay, so did they tell you that? Did they say, like, you've changed my life, doctor, or I should have done this years ago? Did they say that?
Oh, yeah. They feel like they're back in the game. Yeah, they're not dental cripple. They're just like you and I. They look, they look good. Like I said, your smile.
Your teeth are good too.
Yeah.
Are those MiniDental implants?
No.
Are you sure?
Yeah, no, I'm happy with my smile. But if I lost a tooth, that'd be exactly what I would do.
You really would. So if it was your own teeth, you would put a mini implant?
Oh, absolutely. If it was me, my dad, my family, absolutely. Of course I would. It's less invasive. It's less discomfort. They're so successful.
You call it the third set of teeth. It's like your third set. Elaborate on that. What do you mean by that?
Well, you grow up, you have a baby set of teeth called deciduous teeth, and you have your adult teeth. And unfortunately, if you lose those, used to be that's all you had. But with MiniDental implants, now you have your third set, that last option to get back to where you were as naturally as possible.
Now we should mention, we have to take a quick break, but Medicare, Medicaid does not cover implants here in the U.S.
No.
Insurance, I guess whatever your maximum payout will cover a small portion of it. Mm-hmm. But you finance people.
Absolutely.
Is that right? I mean, you actually carry
Absolutely.
the loan.
That's what we do. We are taking every step we can to make this successful to everybody. So yes, we have in-house financing. We also have care credit and other forms of financing. But listen, the in-house financing is a big hit in our community. People come to us just for that because we make it affordable where they can come in and get what they want, not just, patchwork. They can leave restored. They can leave happy because they can make it affordable.
What if you have bad gums, right? Let's say somebody comes in, their teeth are just literally falling out. Are their gums too bad to get this done?
Absolutely not. You remove the teeth and then the gum disease just goes away. That's not an issue anymore. You still need to keep your implants, you still need to be hygienic. But you don't have to worry about just because you have gum disease or your teeth are loose, because once we remove the teeth, the gum disease, that's the end of that. So.
Is that right?
Yeah.
Okay, we're going to take a quick break. We come back. You brought a bunch of these models.
Yeah.
So and you show these to patients.
Yes, absolutely.
Is that right? So we'll go through the process of what it's like on a consult when they come back. Mm-hmm. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Before, when I would be speaking to my students, my teeth would move. Not anymore. They are just as solid as my natural teeth were.
Come see us at Advanced Dental Center. Call now at 843-629-8000.
You're watching the Wellness Hour. Today's topic, replacing missing teeth with dental implants, MiniDental Implants. And according to my guest, Dr. Griffin, he says nobody should be wearing a loose-fitting denture. And if you've been diagnosed or told that you are headed to dentures, they have to remove your teeth, he said don't go with a traditional denture, right?
Absolutely.
I don't want to put words in your mouth, but that's kind of how you're feeling about it.
Oh, absolutely. I mean, well, look at this. Honestly, this is a very well-designed, effective prosthesis. It looks nice. Somebody did somebody did a good job, very professional. But this comes in and out. It has wires around all your teeth. And when you chew, sometimes it accumulates food and you have to go in the bathroom, brush it out, rinse it out. But not anymore. Not anymore. Absolutely not. Your days of having to take something in and out are gone. We put the teeth in and they stay in. And that's what people want what you and I have. Even though they had a failure in their life, they want to go back to you.
Having teeth that you don't even have to think about.
And a nice smile. And look at the confidence that you have. They want what you have.
It's because of my teeth.
A lot of
Well,
it
I probably
is.
take it for granted because I've had my own teeth.
Don't kid yourself. Don't kid yourself. Let me tell you about your smile. People care more about their smile than any other part of their body. Survey after survey. You want to go to Red Book, you want to go to this survey, Woman's Life, whatever. Especially ladies, their teeth are what make the difference. Because people want to communicate. People want to be understood. And you can't be understood unless you can talk with confidence. If you're talking like this, looking down, it just doesn't work. You want to be upbeat. You want to be positive. You want to be outflowing, leaning forward. You want your life back. And your smile is the gateway to that communication and understanding with other people. People have lost their mojo. You can see them walking around.
They lost their mojo, you said.
Yeah, exactly.
Okay.
They lost that swag, because they know they can't really go out to eat. They can go with people, but they're not going to get to eat what they want to eat. And they're not going to be able to get up in front of people and talk with confidence. Like ministers were telling me, God gets up there and gives a great sermon, but he really can't get into it because sometimes his teeth fall out. But once you snap them in, then he can lay the hammer down. He can, really have that confidence, and give that, emotional response that he wants to give.
Now, we are short on time, but you brought some of these models, I guess, to show me the options for denture wearers.
Right.
So when they go in to see you, what's discussed?
Okay, this is what we show them. This is the traditional. This is where it has been around for 100 years. A denture, something you put powder in, you stick it in, and you hope it stays in. Okay. But what we have now,
You love these things.
Oh gosh, look.
Okay.
Snaps in.
Yeah.
See that?
Yeah.
See that?
Yeah.
Look at that. Wouldn't you like that? Have that security, that stability? Yeah, sure.
All right.
Absolutely. But this, you can never get that versus this. And the same thing, the bottom is even more outstanding because the bottom is harder to stabilize than a top. But with the bottom, you put it in. You hear that?
See this.
Yeah, it snaps in.
The lower, so you could put like 4.
Yes.
You could put even more mini implants in there to give them something that doesn't come in and out.
Absolutely. Absolutely.
What seems easy enough.
Listen to that. Doesn't that sound good?
Now, you said it gets so tight, sometimes they can't even take it out with their hands.
Yeah, sometimes they do, but they get used to it. But it's
you could adjust it though, because some people have arthritis or whatever.
Yeah.
You could adjust it.
Right. Look at this though. Look at that one more time. Do you see that right there? That covers.
That's an upper denture.
That's an upper denture. That plastic covers the roof of your mouth. That's unfortunate. Not anymore. See this? See this? There's nothing there. You take this off. Look at this. See, you can taste again. You can taste your food. You can talk better. Your airflow is better. You're back to close to what you had naturally. And we have even another step up from that where we can just put pure zirconium, which, like I said, looks just like veneers. Looks like your teeth.
Is that right? And then so they could get a set of teeth that don't come in and out.
Absolutely.
And they could do this at any age.
Absolutely.
Like 80s?
80, yeah. Like I said, I had an 80-year-old early this week. Yeah, no problem. It's funny, I called him the other night, and he says, He was so appreciative. He said, I can't believe what you're doing for me. And you call me, you care about me. I said, well, of course I care about you. You're a good guy, and we're having fun. You're gonna, you having a better life gives me a better life. It's just fun. We're in this together. It's like a team, We're winning together.
We are out of time, as I've mentioned, like a minute left, but you have a Wounded Warrior program where you may do some dental work for free. Elaborate on that.
Yeah, if he or she comes back, we're going to take a select few, and we want to honor them the way they've honored me and you. We're sitting here today in a great nation, enjoying our life because of people like that.
So if they have a Purple Heart and they could prove that they have no money for this,
absolutely,
you may do it for free.
I will do it for free. There's no maybe.
Well, that's very nice.
I would be honored, and I hope they will.
Because you don't have a lot of military, I guess, where you are.
No, I don't. But they
got to be out there.
We got to find them.
That's a nice service. Okay, so as a recap, we're out of time. Somebody watching this, they're either losing all their teeth one by one, right? Mm-hmm. They're headed to a denture,
right?
Or they're already wearing a denture.
Mm-hmm.
What do you tell them?
I say come.
And they're still skeptical, by the way, and they're watching this. What do you say to them?
Well, I say you can go to our website and get fully educated. You can come in for a free consultation. We'll give you the latest in dental technology and dental radiography. We have a cone beam that probably people don't understand, but it's the very latest, and the ability to look and diagnose dental treatment. They can come in for a free cone beam X-ray. That's the latest in technology. It allows us to find bone where you didn't know where bone was, and it allows you to put the implant exactly where it needs to be. There's no guesswork because you see things in 3 dimensions. It's a great leap in technology that I'm very proud that we're one of the few offices in the region that have one.
And you have this, and for people just tuning in, we are out of time. We're talking about replacing missing teeth with dental implants. So you do everything right there.
Absolutely, yes.
So you have a team of people. They may come in, they may not see you, but they're going to see one of the team.
That's right.
And you said you guys like each other. You told me that in the green room, and I'm going, why is he telling me that?
Yeah.
But I guess that's important, right?
Well, a good fraternal spirit is going to allow any team to work better together. We're not territorial. We're there to help each other, and it helps us to help the patient much better. I look forward to going to work. I'm glad that when my associates tell me that, Joe, doctor, I don't want to retire. I'm having too much fun. This is the best thing that's ever happened to me. I get that from doctors that work for me, and I'm really happy about that. They don't even want to consider not working in a group practice because of our teamwork, and our staff feel the same way.
Okay, good. I want to thank you for coming on the show. Very interesting.
Yeah.
So no more dentures. You're going to wipe them out in South Carolina.
I'm going to try to do everything I can with your help.
All right. Okay. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.